So as per my previous message, I'm in the middle of spending quite a lot of money because there's a problem in my teeth, which my dentist hadn't noticed or spotted until he left and a locum came and he started probing around and said, no, this is no good. So I've been to one specialist who wanted me in for 11 sessions at a pretty healthy cost. I've gone to another specialist and repaid the assessment fee, all that kind of thing. And I'm going in for 6, I think. But if I'd have known a year ago or 2 years ago, what I know now, I'm pretty sure it would have saved me a lot of bother. And anyway, you'll see. So since good toothbrushes and good toothpaste came along, fillings are kind of a thing of the past. Kids growing up shouldn't have half the number of fillings we have. But everything that I'm going to talk about is below the gum line. So without further ado, Plaque, I've got little notes in front of me. Plaque was described to me like the slime you get on a stone in a river. It kind of sticks to your teeth. Not a problem in and of itself, but the plaque will go down between your gum and your tooth. Now the plaque over time will also turn to calculus, which is the kind of hard crusty stuff that you can hear them scraping off. And again, calculus is inert, I think, but the problem with calculus is that it makes it so much easier for the plaque to stick to. So it's hard for the plaque to stick to a nice shiny tooth, and it's easy for you to brush off. But when it starts turning into calculus, then the new plaque sticks to that, and it's like sandpaper. It's all, gritty and whatever, and the calculus sticks to that much better. It's harder for you to brush it off. What happens is, if that's the tooth and that's the gum line, this starts bothering the top of where your gums meet your teeth, and you end up with these thing called pockets. Now, this is what I don't understand at all. I've been talking to a load of people about this, and I don't understand why nobody is told what pockets are or what the probing depth is. When you go to the dentist and your dentist is going like A34, B2, C51, whatever, those numbers are in millimeters. He's got a probe with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and it's how far he can slide that probe down the side of your tooth, between the tooth and the gum, before he hits the gum, like how deep is that pocket. And 1 or 2 millimeters is great. 3 or 4 is kind of normal, erring towards not great. 5 and 6 definitely not good, and you're kind of in my boat. 7 and onwards, and it's kind of bad shape. So my deepest pocket is 7 millimeters, it turns out, and I've got plenty of 6s and 4s and 5s, and I've got a few 3s as well. But all said and done, I've got the pockets, kind of coming away from my teeth, and that is bad. So the major issue is, one of the problems is that you can't, with a toothbrush, no matter how good your toothbrush, and more on toothbrushes later, you can't brush below the gum line. Like, you can kind of, maybe get in a millimeter or two. But once this starts happening, it's kind of a one-way ticket, and you need some kind of professional assistance to sort it out, generally. So one of the problems is that when the bacteria goes down here, what you have is a change in the population of bacteria. So they kind of, this is what the dentist told me, and they're, she's super professional what she does. The population of bacteria changes, they start communicating with each other, and the stuff that they start excreting then becomes more toxic. And what you end up with is bone loss. It starts to actually dissolve the bone, and the bone is what holds your teeth in. So done a little diagram. So that's a tooth. That's where your gum line should be, up the tooth. Your bone line should be where the top half meets the rooty bit, and mine is significantly down here, by looks like a few millimeters, but bear in mind your tooth isn't massive, so it all counts. And this is shown on an x-ray, and you can just see it. So you could debate some of what I'm going to say, but that's just on an x-ray. My bone line is disappearing. What your body tries to do to sort this out, when it's got all this bacteria going on and your bones disappearing, is you get inflammation. Now, inflammation is your way of your body trying to send, kind of the white cells to the area and sort out the problem. So the inflammation, whilst it's a sign of something bad, is actually something good trying to happen in your mouth. And that's why when they start probing, your dentist will probably know your BOP score, and that's your blood on probing. So when he's poking around and checking the pockets, when he's poking it goes, bleeding, bleeding, bleeding. And that's because bleeding shows there's inflammation, and the inflammation shows there's bacteria. So your BOP, your blood on probing score, is directly related to the amount of bacteria that is kind of down in these pockets. So higher BOP, more bacteria, bad news. So I took my toothbrush to the new specialist, and they didn't ask me to, but because it's a specialist hygiene session about brushing teeth and this kind of thing, thought it makes sense. And I was quite proud of my toothbrush, like a ultra sonic toothbrush. And I was like, oh, well, at least I've got this in the bank. And she took one look at it. It says, bin. And she totally sold me, ultimately. What she did was, I brushed my teeth that morning thoroughly, and this is the killer, I've been really diligent over the last years and years, twice a day, flossing, I do in my car on the way into work. And my teeth are still knackered, and I think largely because I had a crappy toothbrush, which has really bummed me out. So I brushed my teeth, then she gave me a disclosing tablet, which is one of these things you crunch up and it shows the plaque. And there's plaque everywhere, man. My toothbrush hadn't been getting it off at all, which really bummed me out. So more on the toothbrush in a bit, but my plaque score when I went, having used my own toothbrush, so at my last sitting, if you like, my second last sitting was 71%. Obviously, the higher the plaque score, the worse it is. And the lower the plaque score, the better. So after I bought the new toothbrush, which she recommended, and spending quite a long time and doing it in the right way, my plaque score went down to 17. So 71 to 17%. So that's like straight away massive improvement. My BOP last time, and it's been around this since the first diagnosis that it was all going a bit wrong, was 55%. My BOP went down, so that's blood on probing, so how much blood there is, when she's poking around. That went down to 21%, so that's much better, but that should be below 10%, so that's got to get down there as well. And I'm going back for a full mouth detox, which is 2 hours in the chair. And one of the issues is I'm going back to a professional or a dentist, when they're just kind of scraping around, they can't scrape down 6-7 millimeters. They can't see what they're doing, and they can't the tools just aren't designed for it. So you've got to go for a specialist kind of session, and if it goes much further than that, they have to get surgical. They have to cut your gums open, flap them down, and start scraping. And if you're really unlucky, you've got what's called a furcation, and that's where the kind of, that's the crown of the tooth, and these are the roots. That's where the bacteria has actually gone down and gone under the, where the root gap is, and it's kind of met in there. So if you imagine they're trying to get in here, and the way they diagnose that is if it's got this kind of curly prong thing, and they stick it down the side of the gum and see if they can run it in there. And if it goes in, if they can run it through there, that means the bacteria that's your bone has gone low and your bacteria is going in there. So yeah, so all my stuff's heading in the right direction, but I need to get my BOP below 10%. And yeah, I've got to go back for the specialist stuff, because they can't just scrape it around like they can if it's 2, 3 or 4 millimeters. So another thing, why don't dentists just give out disclosure tablets, or say go and buy some disclosure tablets? Because it's pretty alarming. Like, you think you've brushed your teeth, and then you have one of these things, crunch, and it stains all the plaque on your mouth. And you think, well, yeah, this needs sorting out, because if you see it, it's kind of alarming, and you'll just take better care of your mouth. And it really highlights where you're not getting at. So obviously, that here, that's the thing to get to. That's what it showed with me, amongst other things. In here, that I thought I was super diligent with, was completely blue. My toothbrush just wasn't getting it off. Dental floss, she said, good for getting bits of meat out of your teeth, but ultimately you are not getting plaque off. Like she said, it's like a sticky slime on a stone. And if you imagine getting a long piece of dental floss and trying to get that off, get that river slime off a stone in a river, like, you're really going to struggle. You need to brush it off. So that's where the Interdental brushes come in. They're like a little bottle brush, a little bit of curly-whirly wire with, lots of bristles in. She sent me away with 4 different size packs of them. which was a pretty good going away present, and some disclosure tablets. And they're a bit of a pain to use and they take quite a while. So this is just one of those things, like if you've got no problem or you don't care, then you won't be bothered to use it, and that's fine. But so I do that every night now. You know, I still have the dental floss things, and you know, around and about the house and in the car and at work. But yeah, this is what's going to actually scrape the plaque off from in between the brushes, and you've got to use the tightest one you possibly can to get in. And they do bleed, man. You bleed, like all of this, it involves gum bleeding and whatever. But then that is a sign that there's inflammation, and what you're trying to do is get rid of the inflammation by getting rid of the plaque and the bacteria. So scrape it, and that again has contributed to my much lower BOP. Mouthwash, pretty pointless. Doesn't really kill plaque, doesn't stop the growth of plaque. So who knew? I don't know what the adverts are talking about, or if my woman's completely wrong, but I'll probably still use it occasionally. But whatever happens, don't use it after brushing your teeth. When you brush your teeth, it leaves, so two things. One, don't put water in your mouth before you brush your teeth. Your toothpaste is a consistency that is an abrasive. So if you're watering that all down with a mouthful of water, you're lowering the abrasive power of the toothpaste, so you're going to get less plaque off. Secondly, don't wash your mouth out either with water or mouthwash after you've brushed your teeth, because the toothpaste has fluoride and other good stuff in it that's meant to sit on your teeth and kind of get absorbed by your teeth. And if you rinse your mouth out, you'll just spit it out again. So I think like toothpaste has something like 10 billion parts per trillion of fluoride or whatever it is, and mouthwash does have some, but it's an absolute fraction, so you're still washing most of it away. Smokers, so there was an interesting thing about smokers, that nicotine reduces blood flow to the gums. So one, it can mask, so that will stop the inflammation, but it doesn't mean that the bacteria isn't getting in. So it just means that if you're a smoker, you might have a low BOP because there's less blood there, so less inflammation, and it'll just be masking it. So if you're a smoker, it's kind of hard to tell what's going on because there's no BOP score. So you could have quite deep pockets, but that won't really show what's going on. And if you've got no inflammation, then the good stuff isn't getting there to kind of help clear out the bacteria. So that's a kind of a double bubble problem. The best toothbrush, so they're just, I mean, I don't know. I when I was reading about it, I read that ultrasonics were the best. And they were talking about like the ends of the bristles move so fast that it actually agitates the water molecules beyond the end of in your mouth, beyond the end of the bristles. So they actually clean further than the end of the bristles. And I love the science of it and that kind of thing. But she said absolutely categorically, there is a report that has been done relatively recently. And she said she used to have an ultrasonic toothbrush at one point. And the report is the ones that work best are the Oral-B kind of rotating your head things. And I think they go round that way and forwards and backwards that way. The bad news is that the very best one is 250 quid. And the thing that goes round that way, forwards and backwards that way, and it's ultrasonic. And that's 250 bucks. So that's a bummer. But the good news is the next best one on Amazon is 33 quid. And that goes round that way and forwards and backwards. And that's an Oral-B Pro 2 2000. And there's a Pro 3 and a 4 and a 5 and a 6, but they all just have whistles and bells that are of no use, like settings you just don't use that do, pointless stuff. So you said don't bother with any of them. Just get that one. So I've got one, Gail's got one. I've given this spiel to a couple of people at work. They've got them, so I'm like an Oral-B salesman at the minute. Best toothpaste, Pro Expert or Crest. And that is about it. They just have the best things in it. So if you're remotely into it, here's a couple of things you can ask your dentist if you go to a dentist again. Ask him if you've got any pockets. Ask him what the probing depths are generally. How far can he poke his probe down? Because all the dentists I've ever seen, including the ones I thought were good, were like, oh, we're going to keep an eye on this and an eye on that and this kind of thing. And like, it was all wishy-washy, but I'd have liked to have had a bit, including private dentists, I'd have liked to have had a bit more insight into what exactly was going on, because this has to have been happening over a period of time in my mouth. So have you got any pockets? What's the probing depth generally? 2, 3, 4, 5 mils. What's your blood on probing percent? Which is something they can, they're doing it as they go around. And if you have an x-ray, which normally costs, I don't know, 90 quid or something, but they do periodically as a matter of course. Does it show any bone loss? I don't remember. I remember having x-rays over years and years, and they didn't really go into any of these details. So that is about the size of it. If you made it this far, well done. I hope you enjoyed my little picture of a tooth.